In this year, where South Africa is hosting the G20 summit, the healthcare agenda has been a very important part of South Africa's theme of solidarity, equity, and sustainability. Today, we've had a conversation about vaccine equity and Africa becoming more self-sufficient when it comes to vaccines. We all saw that during COVID, Africa was left at the back end of the queue, including our own country, South Africa. We couldn't access vaccines timely, and unnecessary lives and livelihoods were lost. So today's conversation amongst the various multilateral institutions, European partners, the industry, was how do we accelerate the local manufacture of vaccines and other pharmaceuticals so that we not depend on the rest of the world when the next pandemic, when there's an outbreak of the next pandemic. And the two key takeouts are, number one, we need to cut through the red tape that currently exists. There's excessive red tape, which means we cannot accelerate the production because of regulatory processes, cannot accelerate the production of vaccines in South Africa and on our continent. And then the second issue is we need the support of multilateral procurement agencies that procure these products. We need their support. They need to start buying African-produced vaccines for Africa, from Africa. Those two are very important discussion points that came out today and fit in with, of course, the theme for this year's G20 that South Africa has selected, which is solidarity, equity, and sustainability. We need vaccine production to happen at speed in our own country.